Let's take a look at some of the anatomical features of the scapula, also known as the shoulder blade. So we're looking at an anterior view of the scapula here. A couple things to note in this view is this knobby area right here. This is called the coracoid process. And this fossa here is called the subscapular fossa. Now let's take a look at the posterior view. The posterior view is easy to distinguish from the anterior view because of the presence of this structure here, which is the spine of the scapula. At the end of the spine of the scapula is a structure called the acromion, also known as the acromion process. We do have two fossae on the posterior side of the scapula. There's a fossa below the spine and a fossa above the spine, and that's how they're named. This is the infraspinous fossa, and over here would be the supraspinous fossa. Let me angle this differently so you can see that supraspinous fossa a little bit better. Looking at a lateral view of the scapula, kind of looks like a spaceship, right? This is the acromion. This is the coracoid process. And this structure here is actually the socket that the head of the humerus will fit into in order to form the shoulder joint. And this is called the glenoid cavity, or sometimes it's just called the glenoid. Let's take a look at some of the anatomical features of the humerus. So the humerus is the bone that we find in our upper arm. This is the brachial region. Okay. So this is the proximal end of the humerus, and this is the distal end of the humerus. Okay. And we're looking at an anterior view right now. So let's take a look at the features on the anterior view. This rounded area on the proximal end is called the head of the humerus, and that articulates with the glenoid cavity on the scapula. Close to the head, we can see two protruding structures. Okay. This is called the greater tubercle, and the one below it is called the lesser tubercle. And there's a groove between the two called the intertubercular sulcus. As we go more distal on the bone, we can see a roughened area here. And this is an important area, the deltoid muscle, which is sort of like your shoulder cap muscle, where you get your flu shot. The deltoid muscle inserts on this area here, and this is called the deltoid tuberosity. So someone that has a really big deltoid muscle will have a rather large deltoid tuberosity. As we continue downward to look at the distal end of the humerus, you'll notice some unique features here. So this area is going to form the elbow joint. So it's going to articulate mostly with the ulna. Okay. So a few features we see here. This structure here is called the trochlea. This dip here is called the coronoid fossa. Okay. The ulna has corresponding structures of a similar name that will fit into those areas. This area here, it's kind of rounded, right? And round like a head. Capitis means head, and this is called the capitulum. Now let's take a look at the posterior surface of the humerus. Going back to that proximal end, we can see the head of the humerus, and not a lot of other features from this view. Going back to the distal end, right, we see another fossa. This is called the olecranon fossa. So again, there's a corresponding structure on the ulna that will fit into that fossa. This area here is still called the trochlea. This is the ulna. The ulna is a bone in your forearm, and it's found on the pinky side or medial side of your forearm. This is the proximal end of the ulna, which articulates with the humerus. And this is the distal end of the ulna, which articulates with the carpal bones on the hand. And we're looking at it from sort of a quasi-side view here. You can tell this is the ulna because see how it has this structure here that kind of looks like a U, right? So U is for ulna. At the proximal end of the ulna, you have three important structures: the olecranon process, the trochlear notch, and the coronoid process. Each of those structures has a corresponding structure on the humerus. So the olecranon process of the ulna will fit into the olecranon fossa of the humerus, like this. So that forms the elbow joint. Notice that the trochlear notch fits into the trochlea of the humerus. And then likewise, the coronoid process of the ulna will fit into the coronoid fossa of the humerus. Also of note on the ulna is this little sticky outy piece down here at the distal end. That's called the styloid process, and this is a bone that you can feel. It's palpable at your wrist. Now let's take a look at the radius. So the radius is also a bone found in your forearm. Okay, this is found on the thumb side of your forearm, and a good way to remember that is that thumbs up for radical. Radical radius is on the thumb side of your forearm. And that's, of course, in anatomical position. Right? There's really only two structures you need to know on the radius. The head of the radius, which will articulate with the capitulum of the humerus. So here's the capitulum of the humerus, and the head of the radius articulates there. Also of note on the radius is this little sticky outy piece down here at the distal end, right? This is the styloid process of the radius, and like the styloid process on the ulna, it is palpable at the wrist. So the wrist joint is really a joint between the carpal bones of the hand and the ulna and the radius. Right, so this would be the wrist joint. So we've already looked at the ulna and the radius. Let's take a look at the bones of the hand, right? So these tiny bones are called the carpal bones, right? These bones here, which form the palm of your hand, those are the metacarpals. Meta means between or in the middle, and the metacarpals are between the carpals and these other bones, which are called the phalanges. Each digit has a number. The thumb is digit 1, and then 2, 3, 4, and 5. Notice that all of the digits except the thumb have 3 phalanges. The plural is called phalanges, but the singular is phalanx. So these two are both phalanges, but singular, this is a phalanx, and that's a phalanx. We have proximal phalanges and distal phalanges, right? The thumb only has a proximal and distal phalanx, whereas all the other digits have 1, 2, 3 phalanges, proximal phalanx, middle phalanx, and then distal phalanx.